We're now live. You can go ahead.
Thank you so much for joining us today. I'm Lynda Hopkins, Supervisor for Sonoma County's 5th District, and this is our COVID-19 update for Wednesday, August 18th. We're going to go ahead and start with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa organizada por la Supervisora Hopkins y la Doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Supervisora Lynda Hopkins.
Thank you so much, Gilbert. I really appreciate it. We're going to start off this update with some good news. In the past week, we have reached another milestone in our ongoing vaccination campaign. I'm happy to report that 80% of eligible Sonoma County residents 12 and older have had at least one dose of a COVID vaccine. And that's also an important note is that 72% of our residents are fully vaccinated and another 8% are partially vaccinated. Now, while our pace of getting people vaccinated has slowed considerably, given that such a large portion of our population is fully inoculated, we have seen an uptick in our vaccinations recently, and we're back to doing more than 1,000 inoculations a day in Sonoma County. Yesterday, for example, we were able to get 1,400 people vaccinated. So that's very encouraging progress, and we really appreciate all of our community partners who are working very hard to get this done. However, given the spread of the aggressive Delta variant in our community, we can't back down. The Delta variant is 60% more contagious than earlier mutations of the COVID virus, and we are seeing and feeling its impacts in our community each and every day. Therefore, it's more imperative than ever that we get as many members of our community vaccinated as quickly as we possibly can. For that reason, I'm grateful that my colleagues on the Board of Supervisors yesterday joined me in voting to approve a new policy requiring all county employees to either show proof of vaccination or submit to weekly testing to ensure that they're negative for COVID-19. This policy, which will take effect September 7th, will apply to all of our 4,400 county employees. And we believe that it will make our county workplace safer both for our employees and for our customers who come and utilize county services. By adopting this measure, we also hope to set an example that other employers will follow. And we're gratified to see that many employers in Sonoma County already are following in our footsteps or even leading the way. Some restaurants are now asking to show proof of vaccination before allowing customers to sit inside. I really believe that it's important that we all work together to create safe work environments within our community, especially in the face of the Delta variant. Meanwhile, we're continuing to connect with the difficult to reach unvaccinated populations through our constellation approach of vaccine clinics and pop-up events. Just this week, as the state decided to end a contract that would have shuttered our longstanding vaccine clinic at the Rohnert Park Community Center, our county staff quickly came together and found the resources needed to keep that clinic operating without any break in service. So thank you so much to the county staff who worked around the clock to get that done. That's exactly the kind of teamwork that's going on behind the scenes each and every day to ensure that vaccines and testing within our community remains as easy to access as possible. As much as we want it to be over, unfortunately, the pandemic is not over. People are still getting sick, and the virus continues to circulate within our community. And many people have questions about things like testing and booster shots. We hope to provide some answers to you about those questions today. But first, I'd like to go ahead and turn it over to Dr. Sundari Mase, Sonoma County's health officer, for an overview of the current state of the pandemic. Dr. Mase?
Great, thank you so much. As Supervisor Hopkins just said, our vaccination campaign is the most important tool we have in fighting the pandemic. Here's a good example. Our case rate continues to climb with the highly contagious Delta variant circulating in the community. Our case rate per day per 100,000 residents is now about 20, but that only tells part of the story. Among those who are unvaccinated, our case rate is 40 per 100,000, while those that have been vaccinated, amongst those, the case rate is 8 per 100,000. So just from these numbers, the rate of COVID infection is 5 times greater for unvaccinated residents than for those who are vaccinated. And we also know that those who are unvaccinated are far more likely to end up in the hospital and to experience the worst outcomes from the virus. More than 80% of the COVID-19 patients in Sonoma County hospitals are residents who are unvaccinated, while more than 90% of COVID-19 ICU patients are also unvaccinated. And as Dr. Krilich will talk about in a few minutes, our hospitals are stressed at the moment, which is very concerning. As of Tuesday, 84 patients were hospitalized in Sonoma County with COVID-19. Of those, more than 20 are in the intensive care unit. That's more than twice the number of hospitalizations that we had a month ago, and 3 times the number of ICU patients from a month ago. This speaks volumes about the importance of getting vaccinated. It also shows the importance of testing, particularly for those who are still unvaccinated. So let's talk a little bit about testing. Given the rise of COVID cases due to the Delta variant and the increasing numbers of employers who are requiring testing for their unvaccinated workers, the demand for testing in our community has increased more than 60% in the past month. In response to this increase or demand in testing, Sonoma County has increased our testing capacity from 1,000 tests per week to 14,000 tests per week. We've done this through partnering with 4 trusted providers: Curative, LHI or OptumServe, Molecular Matrix, and Fox Home Health. We're now offering expanded COVID-19 testing services throughout the county through these providers. Please do go to socoemergency.org/test for more information on testing, including pop-up testing sites that are in your area. The webpage offers a calendar of all testing clinics available each day of the week and information on how to make an appointment. Finally, we'd like to talk to you about boosters. We know many of you have questions about when and how you'll be able to get your booster shots now that the FDA and the CDC have approved boosters for some of those who have received the Pfizer or Moderna vaccines. We understand your eagerness, but we want to be clear that these boosters were approved for a very specific group of individuals within our community. These are just intended for people who are severely immunocompromised, such as people who've had organ transplants, cancer patients, or those undergoing hemodialysis or other immunosuppressive therapies. I will present that as slides in a few minutes to go over some of these specifics. So now I'd like to turn this over to Dr. Urmila Shende, Sonoma County's vaccine chief, to give us an update on vaccines.
Thank you, Dr. Mase. As Dr. Mase mentioned, we're getting a lot of questions about booster shots. The U.S. Food and Drug Administration last week authorized 3rd doses of both the Pfizer and Moderna coronavirus vaccines for immune-compromised people. But it's important to underscore that this booster is not intended for everyone at this point. This additional dose of an mRNA COVID-19 vaccine should be considered only for people with moderate to severe immune compromise due to a medical condition or being a recipient of immunosuppressive medications or treatments. In other words, please do not show up at a vaccine clinic and expect to receive a 3rd dose. At this point, we're encouraging residents to contact their primary care physicians to see whether they are eligible for the booster shots, and if so, to arrange with their provider to get a 3rd shot of the vaccine. If you do not have a primary care physician but believe you qualify for a booster, please go to myturn.ca.gov to make an appointment. You'll be asked a series of questions that will confirm that you are eligible before you can make an appointment. To add to all of the information that's come out this week, the Biden administration today announced that they're prepared to begin rolling out booster shots for many Americans the week of September 20th. We're eager to hear more about that directive, but it's important to remember that this program is still a work in progress and the plan will need to be approved by the U.S. Food and Drug Administration. These plans are for allowing boosters based on data that show the effectiveness of Pfizer and Moderna vaccines against COVID-19 diminishes over time. But this is not an urgent issue except for perhaps those who are immune compromised and did not build the same level of immunity from the vaccine series as everyone else. The CDC data shows that the Pfizer and Moderna vaccines remain at least 84% effective against hospitalizations. So those who are fully vaccinated are still protected from the worst outcome of this virus. In many cases where there are breakthrough infections of vaccinated people, individuals often show no symptoms and are back to full health quickly. I look forward to answering your questions about the vaccine. But first, I want to turn it over to Dr. Chad Krilich, Chief Medical Officer for Providence in Sonoma County, to give us an update on what Memorial Hospital and other Providence health centers are experiencing right now. Dr. Krilich?
Thanks, Dr. Shende. My name is Dr. Chad Krilich. I'm the Chief Medical Officer for Providence in Sonoma County. Providence in Sonoma County has 3 hospitals. It includes Santa Rosa Memorial Hospital, Petaluma Valley Hospital, and Healdsburg District Hospital. We provide services in the community that includes things such as the management of heart disease, cancer, and Santa Rosa Memorial Hospital is also the trauma center in the area. We also do care for COVID patients. The last time that I was on this call, I had the opportunity to convey a message. That message was, please get vaccinated. That message remains the same. In addition, I would ask if you are vaccinated to have a conversation with someone who is not vaccinated. Currently, there's 100,000 members of our community that are not vaccinated for COVID. And when we look at the numbers across our hospitals, what we're seeing in the census, which are the number of patients who are in our hospitals, is that those numbers are similar to what we saw in December. What is different now compared to December is that the majority of those patients who are in our hospitals are younger and are unvaccinated. In addition, we also very closely watch our inpatient mortalities. Those are patients who have contracted COVID and died in our facilities. When we look at the numbers of patients who have died in our facilities, the numbers in August are on track to exceed the numbers in December. By virtue of what we're seeing happening in our hospitals, it's important for people on this call to understand is that hospitals may not have the capacity to accept transfers. For example, we care for patients as far north as the Southern Oregon border, and we see patients south of us as well. The number of transfers that we've been able to accept are down 20%. Part of the reason why we see this is because of the increasing volumes of patients who have COVID. We know that COVID is a preventable disease. We have a safe and effective treatment for COVID, and that treatment is vaccination. So again, I would just ask those of you who are listening to this call, if you have not been vaccinated, to please get vaccinated. And if you have been vaccinated and you're listening to this call, I would ask you to have a conversation with someone you know who is not vaccinated and share with them your experience. As an aside, I got a text from a member of the community who happens to be connected to one of my children who attends a local high school. This individual had asked me some questions about being vaccinated after not being vaccinated for a long period of time. I can't tell you how happy I was to receive that text and to find out at the end of that conversation that he is going to text me when he gets his vaccination completed after the conversation that we had. And so again, I would just encourage you to have those conversations with people within our community so that we can see an end to this pandemic. Thank you.
Thank you so much for that, Dr. Krilich. Now we're going to go ahead and hear from Kate Pack from our county's epidemiology team, who's going to share some slides showing the data around our current COVID situation. Kate?
Thank you, Supervisor Hopkins. Let's see, here we go. Make my screen bigger. Right. So I wanted to share our latest metrics as of today. Looking at the trends, as of today, we have 19.9 new cases per 100,000 residents per day. We've been holding at this elevated but steady level of around 20 new cases per 100,000 residents per day for the last couple weeks. Looking at our overall test positivity, we are at 6.1% overall. Looking in the areas of our community where residents have fewer resources to support their health, we see in this lowest quartile of the Healthy Places Index test positivity at 8.1%. While our cases per new resident, cases per 100,000 residents per day have been holding relatively steady for the last little while, we continue to see steep increases in our COVID-19 hospitalizations. As of data reported by the hospitals yesterday, there were 83 individuals currently hospitalized with COVID-19 complications. And looking since June 1st, 35 individuals have passed away from complications from COVID-19. Looking at our rate of new cases per day per 100,000 residents by vaccination status, we see that the unvaccinated population is experiencing a disproportionate number of the cases. So the rate among the unvaccinated population represented here in this orange-red line, we see is at 36.7 new cases per 100,000 per day, as compared to 7.6 new cases per 100,000 per day among fully vaccinated residents. And we are seeing this slight drop. It kind of remains to be seen if that is a trend. And we also continue to monitor cases as changes are made in our community with schools reopening and other factors to see if this trend will hold. But as I noted, we've been staying fairly steady around 20 new cases overall. Looking at case trends by racial ethnic group, we see disproportionate impacts of cases among certain racial ethnic groups. So when you take population size into account, we see increased case rates among American Indian, Alaskan Native residents, and Black African American residents in particular, when we look at cases across the last 60 days. We have seen a great increase in the testing volume recently. You can see here, this is looking over the course of the pandemic. We see this upward trend in our cases in the past month, an increase of 60%. Our testing volume as of today is at almost 400 tests per 100,000 residents. And we've seen testing increase across all racial ethnic groups, age groups, and geographies in our county. We've seen, looking at our testing positivity trends by demographic, we've seen that test positivity has remained high in the past 2 weeks among Latinx and Black residents, so 15% and 13% respectively. We have seen an increase among white residents as well. You can see here this line at 10% test positivity. Looking by age, we've seen positivity increase across all age groups, but particularly significant increases in the 5 to 17-year-old, 18 to 24-year-old, and 25 to 34-year-old age groups. Looking by geography, we've also seen increased test positivity across the county, but we've seen particularly high increases in the Cloverdale area with 27% and the Russian River area with 30% test positivity in the last 2 weeks. Looking by age in the past 60 days, we continue to see the majority of cases occurring in the 20 to 29 and 30 to 39-year-old age groups. And I wanted to just briefly look at this graphic so you can see the trend in cases over the last 60 days. So this is looking at 0 to 9-year-olds, 10 to 19-year-olds. You can see here in the 20 to 29-year-olds, this large increase in cases, 30 to 39-year-olds, and so on. As has been discussed previously, we know that the Delta variant is contributing to transmission in our community. The CDC has stated that more than 93% of cases that are sequenced in the United States now come up as Delta. We have seen the same trend in Sonoma County. As of Monday, we had identified 411 instances of the Delta variant in our county. We know that the Delta is over 60% more transmissible and contains 1,000 times the viral load. And as we look at the next slide at contributing factors to transmission, we have noticed increased case numbers as well as the number and size of outbreaks that we're seeing across sectors in our county. So looking at source of infection, we are experiencing increased cases and outbreaks in congregate settings. So these include our skilled nursing facilities, residential care facilities for the elderly, homeless shelters, jails, as well as childcare and youth camps. We are still seeing gatherings contributing to new cases where we know the source of infection. Right now, they account for 27% of cases where we know the source. The kinds of gatherings we're seeing over the past 60 days or so have included large weddings, friend and family gatherings, and youth sports. We've also seen since reopening a significant increase in community transmission in locations such as bars and restaurants and other public venues. So this slide looks more in depth at our hospitalizations and deaths. If you look at this graphic, it looks from January of this year when we were in the middle of that large surge and where we are today. And you can see we're heading back to the same levels that we were seeing in late January of this year. As of yesterday, 83 patients were hospitalized with COVID-19, with 13 of those patients in the ICU. Hospitals have expressed a dual capacity strain where they're seeing increased numbers of COVID-19 patients, as well as patients who may have delayed or waited to get care during the shutdown and are now developing health complications that need treatment. So they're seeing both COVID-19 patients as well as other patients in need of care. Looking at data from May 1st all the way to present, everyone who's been hospitalized, we see that 79% of COVID-19 patients hospitalized and in the ICU are unvaccinated. Looking at our deaths, 98.3% of deaths, so 338 out of 344 of all COVID-19 deaths have been among the unvaccinated. And then looking just from January, when vaccinations were more widely available, we see that 95.7%, so almost 96% of the deaths since January 1st have been among the unvaccinated. As Dr. Krillage mentioned, we have seen trends in the age of hospitalized patients trending towards the younger age groups. So looking over the course of the pandemic, we can see that in this dark blue here, that 65 in patients 65 and older accounted for the majority of hospitalizations. This trend has changed looking from April to June of this year. You can see that while we still see 65 plus hospitalized, the group that's accounting for the majority of the hospitalizations are the 50 to 64-year-olds. And we also see an upward trend in the 18 to 49-year-old group. Looking at our vaccinations in the county, as Dr. Shende mentioned, we have started to see an uptick in individuals getting vaccinated. And looking by age group, we can see in these younger age groups where we saw that the majority of cases are occurring, we're starting to see some upward movement here, and particularly in the 12 to 15-year-old age group. Looking at vaccinations by race and ethnicity, this blue colored bar here represents the proportion of each racial ethnic group that is fully vaccinated. And we can see that a disparity still remains, where a smaller proportion of those, and particularly in the Latinx and multiracial racial ethnic groups, that a smaller proportion is vaccinated as compared to some of the other groups listed here. However, we see progress being made weekly. So looking at change in the numbers of individuals fully vaccinated, we saw that the number of Latinx individuals fully vaccinated rose by about 1,700 between August 2nd and August 16th to a new total of over 55,000 individuals fully vaccinated, which was an increase of about 3%. Similarly, among Black African-American residents, we saw an increase in 103 residents fully vaccinated in that same time period, also an increase of 3%. Looking at our vaccine equity measures, we also continue to see progress here. 25% of all doses have gone to the lowest quartile of the Healthy Places Index, whereas I mentioned earlier, individuals have fewer resources to help support their health and well-being. And looking at residents in this lowest quartile, we see that 62% are fully vaccinated, 8% are partially vaccinated, for a total of 70% at least partially vaccinated. And so while there still is work that remains to be done, we're starting to see the gap close a little bit between this lowest quartile and highest quartile in terms of the proportion of individuals fully vaccinated. And I'm going to turn this over to Dr. Mase for the last few slides here.
Great, thank you so much for the excellent presentation, Kate. I'd like to talk some about why the CDC is now recommending the booster vaccines, or the third shot, for immunocompromised individuals and whom that applies to. So it looks from the data that people who are severely immunocompromised are more likely to make up the breakthrough cases or have breakthrough infection. 40 to 44% of hospitalized breakthrough cases occur amongst immunocompromised people in a US study, a recent study. And it's been shown that there's just lower vaccine effectiveness amongst immunocompromised people of 59 to 72% effectiveness versus 90 to 94% among people who don't have immunocompromised states after the second dose of the mRNA vaccines. That's Pfizer and Moderna. Oh, next slide, please. So this is a little bit of a busy slide, but let me just state that the hashed blue line on the top shows that healthy controls, people who do not have any immunocompromised state, achieve 95 to 100% vaccine efficacy. In other words, positive antibody response with a second dose of Pfizer and Moderna. But as you can see, and Kate, if you could put your arrow on the patients who have cancer on chemotherapy, or patients who are receiving hemodialysis, or those who are receiving an organ transplant or are on immunosuppressive therapies, or others who are on other immunosuppressive therapies, you can see that these groups of people do not achieve the same kind of antibody response as healthy controls. So that's basically what this study is showing. Next slide, please. This study also is a little, this slide that is a little complex, but basically what it's showing is after the second dose, a good proportion, somewhere between 60 to 80% of patients who've had a solid organ transplant do not have antibodies. They don't get immunity from the two-dose series. But if you give them a third dose, an additional 50% or so, somewhere between 30 to 50%, will actually get an immune response with a third dose. So although everybody may not get a full immune response, a good proportion of those who didn't get an immune response from just two doses would get the response with the third dose. That is sort of the thinking behind giving a booster shot for these people. Next slide. Now, those that got the J&J one dose, there is no data to support the use of an additional mRNA vaccine dose. That's a Moderna or Pfizer after someone's gotten a single dose of the J&J vaccine. but the FDA and the CDC are actively working to provide some guidance on this issue. Next slide, please. Oh, okay, thank you. I think that is the end of our slides. And I'm happy to answer any questions that come up about the third or booster dose.
Okay, Dr. Mase, thank you very much. Thank you all for that. Appreciate it. There's a couple of questions that I'm going to throw at you just from our audience, if you will. Again, my name is Paul Gullickson. I'm Communications Manager. Thank you all for being here. The first question I'm going to direct to Dr. Krilich. If you are still with us, I think you are. Yes, thank you for staying with us. The Press Democrat today ran a story about how 7 rural counties in the state are at all-time highs, the number of COVID patients they are treating, primarily due to the Delta variant. You mentioned you have some of the same issues. Now, these counties include some of our neighbors, including Mendocino, Humboldt, and Lake counties. We know that these hospitals are full and they're having to transfer patients to other counties. My question to you is, are you receiving any of these patients? And are you also at a point where you may be having to transfer patients?
So thank you for that question, Paul. We have received patients from other counties who are COVID positive. As it stands right now today, we're able to manage to our capacity. But as I've shared in this forum and other forums, we continue, to evaluate that daily. So, time will tell. I think, the messages that were shared today are important to increase the likelihood of us being able to not only be able to receive transfers, but also to continue to provide the service that we do in the community.
Okay, well, thank you very much. This next question I'm going to direct to Dr. Mase. Dr. Rodolfo on Facebook says, first off, he appreciates all of your work, but he asks, based on the data that we are sharing today, the Delta variant is clearly propagating at an alarming rate. He asks, shouldn't the decision of reopening the schools be reevaluated? What do you think?
Thanks. That's actually a really good question. We are having weekly conversations with the Sonoma County Office of Education. And we do share the concern that we may see more cases and possibly outbreaks as we reopen schools. However, at this point, Dr. Harrington and I are watching the data, seeing what happens. We do have a lot of mitigation measures in place in schools, such as indoor masking for all teachers, staff, students, and even just amongst staff when students aren't present. Schools have put into place a lot of other mitigation measures of social distancing, making sure that lunch is eaten outdoors, that trying to limit contact between students. So I think we need to just follow the data and see what happens to see if it really is a very high risk setting or not.
Great, thank you. And this third question I'm going to direct to you, Dr. Mase, and to Dr. Shende, if I may. Andrea on Facebook asked this question. Can you please address why you aren't testing vaccinated county folks when they have a COVID positive exposure? We know vaccinated folks can contract the virus and transmit it as well. She says, I know several people who were fully vaccinated and still caught it. A few even went to the hospital. I'm not sure whether she means county folks, whether she's talking about county employees or county residents, but do you want to address that question?
Yeah, there is actually a recommendation that fully vaccinated individuals that are contacts to somebody with COVID do get tested at days 3 to 5 after exposure. So that is actually happening to ensure, just as you said, that fully vaccinated people can get COVID and that we don't have a case in somebody who's fully vaccinated. Dr. Shende, do you have anything else to add?
Nothing else to add. Yeah, I think it's a little known recommendation that hasn't been emphasized as much. So it's important for people to understand if people have been fully vaccinated, but they're exposed, they should be tested on day 3 to 5 or sooner if they develop any symptoms.
Great, thank you. well, this is all really important information. Unfortunately, I want to also share that I'm sad to report that we have 4 new deaths that we are reporting as of today within our community. We are sharing this with our media partners. We had one woman in our community between the ages of 50 and 64 who died on August 8th. She was vaccinated. She had pre-existing conditions and was a member of our homeless community. We have a man who over the age of 90 who died on August 9th. He also had pre-existing conditions and was vaccinated. We have a man between the ages of 18 and 49 who died on August 11th, who was unvaccinated. And we have a man over the age of 65 who died on August 13th, who was unvaccinated. Unfortunately, this brings to 344 deaths that we have had in our community since this pandemic broke out. So with that, we want to thank you all for taking part in this COVID update for Wednesday, August 18th. We want to remind everyone that we will be hosting a similar briefing tomorrow, Thursday at 4 p.m. in Spanish, where we will be sharing much of the same information. Recordings for both of these presentations will be posted on the county Facebook page and the YouTube page. So please share these links with your friends and family. This is important information for everyone to hear. Until then, thank you all and be safe.